Christine Schneider, the Visceral Voice.
Welcome to the Visceral Voice podcast. I'm your host, Christine Schneider. Every 2 weeks on this podcast, I talk with voice specialists, manual therapists, health specialists, psychotherapists, movement practitioners, and professional voice users about voice science, function, medication, movement, puberty and aging, and everything in between. I am on a quest, not only to become a better manual therapist, but also to learn everything I can about the living, breathing body and its intricate connection to the voice. This podcast documents the continuation of my learning and my experience as a professional singer, a nutritional consultant, and a manual therapist. Join me every 2 weeks as we strive to provide current, knowledgeable, creative, and compassionate information to help restore, regain, and create happiness and success in your vocal journey. Hi everyone, I just wanted to make a few announcements. The first is that if you haven't already filled out the questionnaire, please do so. This really helps me find out what you, the listener, may be wanting and what direction to take the podcast in. So you can find the link to that in the show notes. The next announcement is that if you would like to become a supporter of the Visceral Voice podcast, you could do that in one of two ways. You could either donate $5 a month and become a Visceral Voice supporter, or you could donate $20 a month and become a Visceral Voice knowledge seeker. Again, there is a link to that becoming a supporter of the Visceral Voice podcast in the show notes. So please check out that link and support us here at the Visceral Voice podcast. And by us, I mean me. I'm actually behind the scenes of all of it. I do everything from researching my guest to coming up with the questions for each interview, doing the interviews, doing all of the editing, doing all of the social media marketing, and keeping it going financially through the systems, making sure that you have the ability to open up episodes that are older episodes. All of that takes time and money, and I greatly appreciate your donation and your support. Thank you for considering that, and again, that's in the show notes. My last announcement is that I am now on Instagram. So if you want to find me on Instagram, you can check out the Visceral Voice podcast. Thanks so much. Gail Wetzler currently owns an integrative physical therapy practice in Denver, Colorado, where they treat orthopedic, fascial, muscular, soft tissue, neurologic, pain, respiratory, digestive, MTBI, and women's and men's health issues. After receiving her initial degree in physical therapy, she pursued her first experience in acute orthopedic care at Hoag Hospital, Newport Beach, California. Within 1 year, she became the outpatient clinical supervisor and thus began her journey and desire for continuing education in the science and art of human movement and function. She studied with Travell and Simons, Minnell, Kaltenborn, Maitland, McKinsey, Mitchell, Jones, and Greenman in the earlier years of manual therapy education. Inspired by these methods of treatment, she became an assistant teacher to Dr. Janet Travell and later an instructor with the Institute of Physical Art, developed by Greg Johnson and Vicky Salaba Johnson. In a few years, she developed her own private practice, at which time she received a large number of head, neck, and TMJ pain patients. This became a driver to learn more about cranial osteopathy, cranial sacral therapy, and how the fields of physical therapy and dentistry could collaborate to help these patients. As she pursued continuing education classes with Dr. John Upledger, he inspired her to learn more about the different systems in the body and how they all integrated for function. During one of her earlier speaking engagements for the Upledger Institute Beyond the Dura, she met osteopath Jean-Pierre Barral, who inspired the importance of anatomy, the ability to listen to the body, and the specificity of tissue dialogue in manual therapy techniques. She has listened and followed his mentoring into understanding the body's deeper fascial relationship of the viscera, vascular, neurological, and manual articular systems since 1989. Gail has been an instructor for the Barral Institute since 1991 and became the Barral Institute Curriculum Director in 2001. In her career, she has been invited to speak at multiple professional conferences, including national and state levels for the APTA, USC Head, Neck, and Facial Pain Clinic, University of California, Irvine, Beyond the Dura Research Conferences, Hope Head Injury Organization, and was the keynote speaker in Italy for the Fascial Manipulation Research Conference presented by Antonio, Carla, and Luigi Stecco. She is the past director of the physical therapy for the Integrative Medicine Center at UCI. She is currently part of the research team for the Upledger Foundation for their recent studies on post-concussion recovery. She currently teaches for the Women's Health section of the APTA, Gynecological Visceral Manipulation. Gail earned her diplomate from the Visceral Institute in 2005. She earned her equine diplomate in osteopathy from Vlugan Institute of Equine Osteopathy in 2009, and she earned her doctorate in physical therapy from Rosalind Franklin University, Chicago in 2013. As you can hear, Gail is an expert in many different modalities. She is a wonderful mentor of mine. I am absolutely humbled and thrilled to have her on the podcast today. Here you are, my conversation with Gail Wetzler. Hi, Gail. Welcome to the podcast.
Well, I'm so delighted to be here with you. I'm looking forward to what your questions would be and see how I can help in any way.
Oh, thank you. I'm so delighted to have you here. And you are an instructor and the curriculum director for the Visceral Institute, and you are one of the most knowledgeable and inspirational teachers I have. So I'm very grateful that you are here on the podcast with me today. Thank you.
Well, you're very welcome, and thank you.
So we are here today to talk about the mechanism and mechanics of breathing in regards to the pressure changes and a manual approach.
Very good.
So you have your doctorate in physical therapy and an equine diplomate in osteopathy. Can you tell us about your journey into becoming a PT and an equine osteopath?
Well, honestly, my love for animals has been there all my life. And I didn't necessarily want to be a vet to do medications and surgery. I really felt the gift was in my hands. And so as I was studying what did I want to do with school and on to college, physical therapy just kept popping up. I, had relatives that were into it. I went to the local hospitals before I chose a profession. And I said, oh my gosh, this is great. This is what I love to do. I love athletics. I love science. So it kind of fit in. Maybe someday this will fit into my love of animals. So I actually was a vet tech that put me through college. And as I was beginning my degree in physical therapy, I was also working on weekends with more small animals, large every so often. And lo and behold, I did get the degree. I worked my way through and working in hospitals, had 2 children along the way. And along comes the group, the special interest group for the APTA, that there were quite a few of us that wanted to learn about and see if we could help in the field of physical therapy with animals. And so in the mid 90s, we actually got together and saw that there was quite a few people. And then we started the SIG group. We worked together with modalities and animal science and veterinarians. And then I, in that interim, went to Michigan State and learned their program in osteopathy. And then I met Dr. Upledger from there. And then I met Jean-Pierre Barral. And from there went on into understanding a lot more about osteopathic medicine and manual medicine. And then I wanted to apply this to the animals as well as the modalities that we learned in physical therapy. So I went back to school in 2009 and went for another 3 years to get my degree in equine osteopathy. And that's how it all kind of came about.
Wow. And that's the equine osteopathy. But for the listeners who may not know Gail, she is actually one of the most sought after and incredible manual therapists of us humans, the human body as well. So I'm really honored to have you here.
So in California, my practice, before I moved here to Colorado, which we are currently living in, my practice was pretty much 60% humans and 40% animals. And then I got much more involved with teaching, international teaching for the Visceral Institute. And so the animals probably went down to about 25%. And my human practice kept on growing. And now out here in Colorado, I have probably 80% humans and 20% animals. So I have a really fun, balanced practice here in Colorado.
Yeah, that's so wonderful. So we are going to talk about the breath. So let's start by discussing how breathing is under involuntary and voluntary control.
Yeah. Well, I would love to say that in the work that we do through the Visceral Institute, In the years that have been put forth into studying the individual organs in the body, everything kind of comes back to the fact that if we don't have a good brain connection to whichever organ we find to have dysfunction, then we're really not completing the relationship in the body. So when you ask me about the mechanics of breathing, you always want to bring in the fact of the potential of involuntary control, very autonomic, that the brain center has a respiratory center in there, and it keeps up the mechanism of inhalation and exhalation. However, under voluntary control, like when we speak or when we sing or
Mm-hmm.
when we play instruments or when we are in control of relaxation techniques, actually, we do have that voluntary ability to control some of the breathing mechanisms. So it's very interesting that these two correlate with each other and that we know how to connect their relationship.
Mm-hmm. Yeah. So, in regards to pressure changes, which I'm not sure some of our listeners might know a lot about, some of them might know nothing about.
Mhm.
So, let's first start talking about pressure changes in relation to inspiration of normal, quiet breathing.
So pressure changes in inspiration. When we have the input that is coming in an inhalation, we want to see that the mechanisms not only are occurring from the airway as you breathe in through the nose, or if you're a mouth breather, but in through the nose as it goes down the larynx, the pharynx, and then eventually in through the trachea and the lungs. All of that has to have a pressure system that is equalized for inhalation or inspiration to occur. So the mechanisms has to be considerate of the phrenic nerve, the vagus nerve, and the posterior thoracic nerve so that the information from the lungs or the pleura gets to the brain and that it says, okay, and during quiet breathing, that we have a little bit of more autonomic responses that are happening and that everything is communicating with each other. And when there is a dysfunction that occurs in that quiet breathing through the nervous system, through a dysfunction in the muscle system, a cold, things like that, that cause changes, even pressure changes of altitude
Mm.
can cause us to be thinking about the mechanisms that would affect the autonomicity of that particular function.
Mm. And so, as far as where it begins, we have talked about how the inhalation of quiet breathing begins at the costochondral joints.
Mhm. So when we're dealing with the mechanism of breathing at the costochondral joint, then we're in regards to the anatomy that surrounds it. We want to be sure that all of that is clear. We want to be sure that the intercostal nerves have the freedom to get to that costal joint. And then the mechanism as it reaches the sternal costal joint and is that envelopes the trachea and then that carries on up the trachea through the nervous system of the vagal nerve. So all of those have dealing with the intrinsic control and the autonomic nervous system. And so we have 52 particular joints that are involved with just the mechanism of intrinsic natural breathing
Mm.
that we have to be sure that's all clear, that that information can go and work with the breathing.
Wow, 52.
Yeah.
And so, with talking about pressure, we're also, for the listeners, I should probably just bring up Boyle's law, which is if pressure is increased, volume goes down. And if volume is increased, pressure goes down. So, if we're talking about atmospheric pressure or that barometric pressure outside of us, which is often at sea level, that intrapulmonary pressure is roughly the same at 760 or 0. And then an intrapleural pressure is at a -4.
Correct.
So if we have chest expansion and we have an increase in thoracic volume, then we have a decrease in intrapulmonary pressure, which creates an inhalation.
That is correct. Yes. Subatmospheric pressure has to stay at a state. If it's negative and the pressure outside is higher, then that creates the atmosphere having the pleura to expand so it increases the volume, so it brings in the air. So that's what inhalation is. It's really, ventilation is controlled by the blood. So the levels of carbon dioxide and the detail of the metabolic rate that is in our blood kind of helps determine to give to the control centers at the respiratory center, oops, the atmospheric pressure has changed, and so therefore I need to increase the volume, and I need to have that ventilation automatically start to come into play now.
Mm-hmm. Something that was fascinating to me in one of the classes I took with you was that you mentioned that only 5% of oxygen actually goes into the bloodstream.
Correct.
That's
Yes.
amazing.
It is amazing. After all that does eventually come in, only the 5% what makes it to the alveolar sacs and that we establish in our blood supply.
Yeah. And so the intrapleural pressure, which is actually the negative pressure, and it's negative because of three basic things: the elasticity of the lungs, the surface tension, and the elasticity of the chest wall, which results in the increasing thoracic cavity volume.
Yes. Elasticity is one of the most important things in regards to us as manual therapists. All those three things need to be in cohesiveness with each other. And if we lose that elasticity, that's when we start to see dysfunction occur in the breathing mechanism.
Yeah. And so on a muscular skeletal level or on a muscular level with inspiration, we're talking about the external intercostal muscles and the diaphragm primarily.
Yes.
And then going into a forced inspiration, what changes? What happens in a forced inspiration?
With a forced inspiration, then the accessory muscles have got to come into play because most of the others are, as we say, under a little bit more voluntary control. So they're used to a certain pace and a rhythm. And when you are in need of extra volume, as you increase your pace, you become a runner, or the altitude changes and things like that, then we need accessory muscles. So they have to turn on, and they are muscles of deeper that are below the diaphragm that attach into helping the 12th rib elongate, so the quadratus lumborum, and the psoas muscle will come in and help with a little breathing. Up above the chest wall, you have the neck muscles, the scalene muscles, and SEM muscles. You have those that will come in and help elevate the upper ribs. And then when that starts to occur, then the diaphragm and the volume increases even more because you're increasing the capacity for the tidal volume and the air to come in. So there's accessory muscles that are very, very helpful when it is called upon us to use them.
Yeah. Okay, and so then after an inspiration, we exhale. So let's talk first about a normal quiet breathing exhalation. What would happen in normal quiet breathing?
In normal quiet breathing, and again, we're listening to the metabolic rate of what your normal breathing is, the muscles that have already been turned on as far as opening up the tidal volume and opening up the rib cage for inhalation, now everything has to be inhibited and quieted down so that the muscles that would ask the ribs to open up, now they quiet down. They start a really slow relaxation. That affects the pleura that would have pulled on and opened up for the pleural space. That starts to relax and come in. Everything comes toward the midline of the trachea, the tracheal branches, the alveoli, into a state of relaxation. So it's a very, very slow but very rhythmical ability to relax out of inhalation.
Yeah, I think it's so important to let the listeners know that the elastic recoil tendency of the lung initiates the passive relaxation of the inspirational muscles. I think a lot of people often think that it's the abdominal muscles. And if we're talking about normal quiet breathing, then we're not engaging that musculature. It is a natural recoil.
It's a natural recoil, absolutely. Mm-hmm.
Yeah, great. And so that begins at the sternum and ends at the posterior rib angle.
Correct. For expiration, the relaxation, if something has to be forced, Then we might be bringing in some abdominal muscles and some others. But for normal relaxation, the recoil starts at the sternum and ends at the rib angle close to the posterior side.
Okay. And so for that forced expiration, as you just mentioned, then we are talking about the accessory muscles of the abdominal muscles, maybe some QL, transversus thoracic.
Right.
Great. So, what does all of this mean for an activity such as singing?
Well, for singing, you must have a good breathing mechanism. If you expect air to be forced through a more closed glottis, the folds have to vibrate against each other. All these mechanisms are the pressures that are behind actually what happens as we speak and as we sing. So we don't want to just keep it the thought toward what's happening at my throat when I'm a singer. I think most of the training is you've got to be thinking from, honestly, I think the training comes from the diaphragm up, but in our experience, the diaphragm, through its connection in the parietal peritoneum, is just another end to the pelvic floor.
Mm-hmm.
And so the pelvic floor is very important in the pelvis to help create the cavities of pressure. Are you stabilized in the pelvic region? Are you stabilized in through the abdominal organ system? Are you stabilized so then the diaphragm does have something to work against? And then when you look at the glottis and epiglottis, it's just the upper end of these main containers that help the pressure systems that are on the inside.
Mm-hmm.
So you want to expand beyond just the anatomy, perhaps, of the throat and the upper chest wall. You want to expand, in our experience anyway.
Mm-hmm. So, do these pressure changes also affect the other thoracic organs?
Well, yes. So if these pressure changes occur, the first one that probably will be affected is the lungs because the subatmospheric pressures will be off if we don't have a good breathing mechanism. The diaphragm, that muscle relates primarily, is the muscle of inhalation that will pull on the parietal peritoneum, which will pull on some of the organs. You know, the organs themselves have movement patterns into them. And you think of the lungs because you can put your hands on the lungs and you can feel that movement. But the organs that are below the diaphragm, they have to have mobility for function and physiology. So the diaphragm and the organs that actually have suspension with them, they move with the diaphragm, and that keeps the actual physiology and function of those organs in a good mechanism.
Mm-hmm.
So breathing is, yes, it's primary for life and it's primary for singers and speakers and things, but it's primary for organ function and the occurrence of digestion and the continuation of elimination as it goes down toward the pelvic organs. So, yeah.
Yeah, great. So, in talking about the atmospheric pressure, we're generally referring to mmHg, which is that measurement of mercury or the measurement of pressure of approximately 760, which I had mentioned earlier, which is at sea level. And you had kind of mentioned a change of high altitude. So, how does performing at high altitude, how does this pressure change how a singer might experience their singing at high altitude?
Well, when you're at a high altitude, it actually lowers the atmospheric pressure. So when it does that, then your lungs have to work a little bit harder because it's supposed to be at a higher pressure. So if it lowers the atmospheric pressure, the lungs have to work harder. And this can cause a shortness of breath.
Mm-hmm.
So if that happens, you can decrease the oxygen carrying capacity of your blood and you might get lightheaded. Things like that can occur as a result of that.
Yeah, at all of the theaters in Colorado that I know of anyway, they all keep oxygen right off stage for the performers. I know many performers who have had to use them, and I've seen performers actually have to bring the oxygen out on stage during a performance.
Wow. I wouldn't be surprised.
Yeah.
I've not seen that. I'm not at the scenes like you are, but I would not be surprised. Our athletes have to do
Yeah.
that here when they move from another state. So,
Yeah, that I remember seeing Doc Severinsen in concert, really wonderful trumpet player, and he just stopped in the middle of the song and said, "Just bring me out the oxygen, and I'll continue after
uh,
I have a little bit." So important. And you're actually the only person that's really kind of addressed that. I'm really interested in research in that area. So similarly, would a big change in the barometric pressure affect the respiratory function?
Yes, it would. When we're dealing with altitudes and then we're dealing with barometric pressures in the atmosphere, that will still have the same philosophy. If there's a storm that's brewing, we've had electrical storms here that have caused atmospheric change in pressures. And not only have I seen it in the humans that have to gasp for air at times, but I've also seen it in our animals when they're outside and we have storms coming in that change that barometric pressure. It's very interesting
Wow.
when you really can focus on it.
Yeah, that's so fascinating to me. So what are three things in regards to breathing that you would recommend to a professional voice user?
I would say, just based on the anatomy that I know and seeing the pressure changes, that if we have a pelvis that has had a lot of surgery and scar tissue in it, that the people have to work harder in through their lungs. They've had abdominal surgeries, like perhaps a gallbladder removed. They have to work harder at it. So when we talk about the breathing mechanism to help a professional voice user, be sure that before you begin, you want to ground your body. You want to think of the body as a whole. And are you grounded in your feet? Are you grounded in your pelvis? Do you have a stable base to work from? In breathing, everything works together for the good.
Mm-hmm.
And that I think you need to look at the body as a whole. That's probably number one.
Mm-hmm.
Number two is when we're dealing with inhalation, it more relates to the sympathetic system.
Yeah.
So it's more stimulatory as you inhale. And as you exhale, that relates to the parasympathetic system. So that's for more relaxation. So as you are a singer and you're getting ready and you're preparing your voice and you're practicing, what is it that you need right now? If you need relaxation, you probably need to do breathing exercises. Like if you count in and you inhale to a count of 3, you want to exhale and count out to maybe 4 or 5 so that you have a little bit more control, that voluntary control, and you are working with your parasympathetic system if you need more relaxation. Maybe graduate that as you work with your breathing techniques, that you breathe into still a count of 3 or 4, but you breathe out to a count of 6 or 7 as you graduate into relaxation. So that's something to consider. You may have had techniques that have taught you that before, but there's really a physiological reason. And it is because if you want sympathetic system to be stimulated or the parasympathetic system to be stimulated, that's food for thought for you.
Yeah, that is so important because we all talk about the power of the exhale, a lot of us in the world of voice, but I do think it's so important to understand that there are physiological changes happening. So thank you for saying that.
Yeah. And I would say the third thing is to not isolate your thoughts of breathing just to your throat or to your lungs. That if you find that you have restrictions in other areas of your body, perhaps pain in an area, but that you actually want to resolve some of the complications elsewhere in your body. So you may have to seek out extra help, going to see somebody that maybe they can find where the restriction or dysfunction is in the body that will actually help you breathe with greater ease. I had a person come in that was a professional singer, and their dysfunction was in the lower abdomen because they had an injury with birthing.
Mm-hmm.
And there was scar tissue, and the episiotomy turned into a tear, and it caused quite a bit of tear into the floor, the peritoneum and the floor. And that was restricting and caused more restriction up the back wall of the abdomen that went into the diaphragm eventually. As you know, Christine, we listen to the body, we find where's the primary dysfunction for that person.
Mm-hmm.
And that person's goal can be for the singing eventually or for voice control. But where the dysfunction comes from, if they have not been helped by working the lungs or the throat, I would ask them to seek other help. To perhaps there's another area in the body that needs manual therapy or needs direction in some kind.
Yeah, that's exactly why I started my search into visceral manipulation and neuromeningeal manipulation. With my experience in laryngeal manipulation, I was seeing results in many and probably most of my clients, but there were, I don't know, probably 25-30% that I wasn't seeing results in. And I kept thinking, this is involving other aspects that I'm not understanding and I'm not able to get to right now. And it really made me look into these other modalities. And I think it's important too for any listeners to know that if you're not getting something from the practitioner that you're with, it doesn't mean that they're a bad practitioner, but there are so many different modalities. So it's okay to ask, who else can you add to your team? Or is there someone else that can come in and maybe find something that some other practitioner that you're seeing can't find? Believe me, we could send you to someone like Gail and she will definitely be able to find it.
And I want us to add to that we are focusing on the singers and the professional that way. But the average person that comes in to see a manual therapist that focuses in on neuromeningeal work or visceral work, they often don't recognize because they're not focused like your singers are. And they're not
Mhm.
focused the fact that they're actually not breathing as well as they could. And they feel a torsion in their body. And once they may have that corrected, oh my gosh, I didn't really realize that I actually can breathe better now. So it's
Mhm.
very interesting how important this area is. And I have people that come in with pelvic disorders. And when we start teaching about the pelvis, you can't leave the pelvis alone without talking how important the lungs and the subatmospheric pressures and what we do with the diaphragm and the breathing mechanism to help the pressure system into the pelvic organs as well. So it's such a wonderful ability to help somebody from a singer's point of view and how they focus there, and then the reality of other types of patients that come in, and then they finally see how important that area is to their life and life force as well.
Mhm. Yeah, and then you've been talking about the pelvis. So if we go up to the head and we talk about the phrenic nerve and the vagus nerve, the phrenic nerve innervating the diaphragm, and it comes out from C3 through C5, and it comes around the scalene and through the two heads of the sternocleidomastoid. And so something like a whiplash, say, how can that affect these nerves as they come down and innervate with the vagus nerve, actually the recurrent laryngeal nerve with the larynx, and the vagus nerve with all of our organs, and the phrenic nerve innervating our diaphragm? How might something like that affect the whole mechanism?
Right. Well, the head and neck are extremely important. It is the highway, if you would, of pressure changes that help with someone that even in a concussion. So head trauma, headaches, and recurrent things like that have to have a pressure system that equalizes down to the lungs, as well as equalize through the jugular vein, the carotid artery system. So how important the whole vascular system is there, and the nervous system
Mhm.
correlates. When we talk about the vagus nerve, that actually comes from a different foramina
Mhm.
and comes from the actual occipital region that goes down, and it travels down along the esophagus. So if the esophagus has some irritability at the upper end or lower end, the vagus nerve is going to be involved with that irritability, or the vagus nerve as it goes through the pathway of the neck and it becomes locked into muscles that have some tension around it, then it doesn't give the impulse that it should through the vagal nerve. And therefore, it is incomplete in its capacity to do its function as it travels down the esophagus, goes through the diaphragm and the hiatus, and then innervates the other organs.
Mhm.
So the vagus nerve is very important for that, and it has branches that go to the laryngeal arteries and the laryngeal nerve, particularly the vagus nerve to the laryngeal nerve. And so that the laryngeal nerve is extremely important. I've had many professional singers come in, and the laryngeal nerve, the cardiac nerve, the vagus nerve is an absolute primary driver for some of their voice complications.
Mhm.
Now, the neck in and of itself, as the phrenic nerve travels out, as you said, 3 through 5, that comes a little bit more extrinsically. We can actually touch that nerve, we touch the fascia that surrounds that nerve. as it travels down through the thoracic inlet, it actually goes and in between the lungs and the pericardium. So it has a little bit wider stance and versus the vagus nerve. But imagine if the lungs or the pleura or the hilum of the lungs, that's the pulmonary vessels, they are distorted in some way, how that will affect the vagus nerve and its pathway down, as well as the pericardium. I've had singers that have come in and they actually had an injury, like a bike injury, and the pericardium got in a slight torsion because the whole thoracic cage was in a slight torsion, and the vagus nerve with that torsion was involved with the rotation or twist. And so we had to work on from the outside in to help the capacity of the elasticity gain back what it needed so the vagus nerve can do its function again.
Mm-hmm. Wow. As you know, I had a head and neck injury 2 years ago, and I was having nerve pain everywhere, but certainly I was feeling it between those two heads in the SEM and down at the Demuses point, which at the time I actually had no idea why I was having nerve pain into my abdomen. It just did not make sense to me. And until I met you and I took your class and we worked on the phrenic nerve, and it helped
Worked on the phrenic
so
nerve,
much. Yeah.
Yeah. A lot of that discovery that you experienced is the actual origination of finding how long that nerve is and what the effect could be, is those that had pleurisy. And so those that had still a tight pleura and some irritability in that. And then we worked as a manual therapist in osteopathy, we worked that particular nerve and saw that the repercussions and signs and symptoms of pleurisy started to change. And that was a real excellent discovery of how we as manual therapists can have an effect on a dysfunction of something that deep in the body.
It's incredible. Okay, so moving on to my signature questions. What is some advice that you would like to give to an aspiring young performer?
I would say my advice in my experience of those that have come in to see me is that you consistently listen to your body. And as you're listening to the body, you're focusing in on the potential of, is this coming as a result of something I ate? And so it caused some irritable bowel. That caused a pressure change, and that's what's changing the quality of my voice right now. Is it transient, or is it something that's become more chronic? What am I noticing about that? So listening to the body is something that I highly recommend focusing in on, and maybe they can do self-help techniques, or maybe they need some help from a professional.
What is your favorite quote?
One of my favorite quotes that I, for myself, my own life, and then for as a teacher, is that movement is life. If you don't have movement, there's not that life. So movement is what I do with my hands. Movement is what I do and help in encouraging people. And I went into the field of physical therapy just to rediscover that movement is so important. And so movement is life.
What are your favorite song lyrics?
Well, this inspired me to think for a little bit, and I love The Wind Beneath My Wings. I love that song by Bette Midler. And did you ever know you were my hero? And so sometimes that hero to a person is a significant other, sometimes that is God. And so whatever that is for you, that you do have the wind beneath my wings, and someone is there to help you always.
I love that. Who influenced your work the most?
My biggest mentor is Jean-Pierre Barral. He is he's amazing.
What is something new about the voice or the body that you learned this week?
This week? Oh my gosh. Well, I learned that the arytenoid cartilage is extremely important for when we need voice control. And we do not spend as much time in that in our coursework. So that's why I would love to do a course together with you. And I do the visceral work, you do the voice work, and we're going to come together and do a visceral voice class for people. So they learn both the importance of this. That's what I learned.
Oh, what is one item you could never live without?
Nature. I just really, nature gives to me so I can give to others.
Oh, man, do I agree with you. Hmm. What is one thing you have on your bucket list?
You're going to laugh. But I've always wanted to do fly fishing.
Oh,
Again, it's out with nature, but it's something I've never done before. And since I've moved to Colorado, I've not had the opportunity yet. So that's on my bucket list.
yes, that'll be so fun. What is the most delightful word you can think of?
Thank you. Always showing gratitude.
Mm,
It's just delightful when someone says it to me and I reciprocate back and just showing gratitude. So thank you is a delightful word.
yeah, it is. What is your favorite book?
My favorite book is The Alchemist.
Mm,
It just helps you find your own heart. And I just love that book.
mm. What are you currently learning?
Well, I'm currently learning a lot about concussions. So I did a research project through the Brawl Institute and Upledger Institute, and we put all that together for the work that we do to bring to the world of concussions. And so that's been a big study of mine. And that's led into another study we're doing on Alzheimer's and how our work can help that as well.
Oh, yes. What do you wish that you would have learned sooner?
So I have moved on into having grandkids. So my kids, when they were in me, I wished I knew then what I know now about pregnancy, labor, delivery. The work that we do creates so much more as far as ease in delivery, ease in through the labor. I help people all the way through their pregnancy with the volume changes and pressure changes in the body and how to create the ease and breath work for labor and delivery. I wish I knew that at that time.
Oh, I wish I knew that now. I'm going to learn it. I'm coming to study that with you.
Yeah.
So, Gail, if the listeners want to get in touch with you, if they want to contact you, what would be the best way to do that?
Well, I would love them too if they have some questions that I can help them with. And the best way is through my email, which is Wetzler, Wetzler, D as in dog, P as in Paul, T as in Tom, at gmail.com.
Excellent. Thank you so much for joining me tonight. To the listeners, we're having a little technical difficulty, but you won't even know it. So thank you for putting up with all of this with me and for being here and just sharing your knowledge, your wealth of knowledge. I'm really, really grateful and just truly honored to have you here with me. Thank you so much.
You're so welcome. It was a pleasure.
Thank you all for listening. If you enjoyed this podcast, please share it with those you know. You can also subscribe, rate, and write a review. If you want to connect with me, you can now find me on Instagram under The Visceral Voice. You can find me on Facebook under my name or under Lifelight Massage, or you can check out my website at lifelightmassage.com. Please join me in 2 weeks for another wonderful conversation on The Visceral Voice.